there's been reviews in the literature, particularly on having a distillate of common factors that influence very good, favorable performance at accountable care organizations, both, again, in terms of cost, so reducing cost per capita, reducing total cost of care, but also in terms of quality metric performance. And that includes a range of different things. So care coordination, effective care coordination that is proportionate to the needs of your community or communities and or populations. Pharmacy having really structured evidence-based approaches to pharmacy, for example, with MedRec, with medication adherence, comprehensive medicines management. Another hugely important factor would be the quality remit within the accountable care organization. So we have teams within the ACO who help with quality gap closure, both in terms of outreach. So for example, outreach to our patients who are in need of their cervical cancer or breast cancer, colorectal cancer screening, other preventative metrics, medication adherence, statin use in patients with diabetes. So having that quality team is very important, and that's informed by our electronic medical records as well. So having that data analytic and a strong supporting EMR that enables our teams to make really strong, informed, actionable decisions on things like on quality. I think another part of it is having a network, an engaged network, and some may call it a high-performing network, but certainly an engaged network, and being very collaborative with them, both in terms of performance optimization, but really, talking with them, collaborating with them, trying to understand some of the challenges that they themselves have in terms of the delivery of value-based care and population health. So for example, across the network, you may have very different electronic medical records, and they may spend at a physician practice level, they may be spending several hours in that EMR to sift out population health data, and they may be spending several hours out of hours within the electronic medical record. And very often it comes up nationally as an important root cause of physician distress. So really, talking with your physician partners to understand some of the challenges that they're having, in terms of being able to get data, in terms of being able to be focused on the populations in need. Another part of it is that data analytic component that we spoke about, the population health analytic framework that enables you to make informed action. So insightful data, action-oriented data, that can help to move the needle on population health and value-based care. Another part of it, of ACO, of maintaining and creating and maintaining effective ACOs and high ACO performance, would be employer-based education. So very often within an ACO, you have cohorts and subpopulations that are based on employer contracts. So enabling employers to understand about all of the services that come with being part of the ACO, so that they can effectively access and manage high quality in-network services. And other parts of it would include things like patient engagement, health literacy, and being able to understand some of the barriers to care, including social determinants of health.